us, we will start shortly. Right. Thank you, everybody that has joined us for today's WRASAP Network quarterly meeting. My name is Esmeralda Mandujano, and I am with the California Agribility Program at the University of California in Davis. Our program is responsible for hosting this network quarterly meetings with the WRASAP Network. And today's presenters include Dr. Annie Keeney from the San Diego State University. She will be presenting on occupational stressors and access to COVID-19 resources among commuting and residential farm workers. And then we will have Dr. Michelle Grokey from Montana State University speak to us about the WRASAP Farmworker Baseline Survey. So as always, we want to start with a little bit of background on what WRASAP is. There are 4 programs in the United States that are funded by the USDA NIFA, and these are programs that are under the Farm and Ranch Stress Assistance Network Programs grant, and they establish regional networks that connect agricultural producers, farmers, ranchers, and farm workers, and others in agricultural related occupations with resources to assist them in times of stress. And also, as this program is funded by, like I said, by USDA NIFA, there are 4 regional programs, and the 4 regional programs are covered the entire United States. The region that we are in is the Western region, and we cover 13 states and 4 territories. There are several partners that we have. These are just a few of the programs that we have as part of this partnership: the California Agribility, Washington State University, Montana State University, Farm Aid, also the National Agribility Program, the University of Idaho, and several other organizations. And with time, we're adding more and more presenters and also collaborators to our list. We do have a clearinghouse in the webpage, which is farmstress.us, where we build a comprehensive searchable database to facilitate easier navigation of resources. We have also added call staff to extend existing hotline operation hours and training for line staff to better support agricultural populations. And we also have a network, which is what these meetings are a part of. The network component is of collaboration and expansion of the network to ensure culturally humble community outreach and support in the region, including Alaska, Arizona, California, Colorado, Hawaii, Idaho, Montana, Nevada, New Mexico, Oregon, Utah, Washington, and Wyoming. Okay. So a little bit more about this networking meetings. These are networking meetings where we have stakeholders come together and are able to build connections and collaboration to assist agricultural producers in times of stress. They also help us improve behavioral health awareness, literacy, and outcomes for agricultural producers, their families, and communities. And collaborators come to these meetings to present their initiatives on health literacy and outcomes for agricultural producers and their families and communities. Collaborators, like I said, also come here to present the work that they're doing and network amongst each other. And this meeting is open to the public and to external partners. So the next thing that we would like to do is we are going to dive into an icebreaker activity that we like to have to help all of us network. We're going to go into breakout rooms, and in this breakout rooms, we would like you to share your name, your role in your organization, the organization that you're with, and share with the group what you're looking forward to in the spring. Some of the examples are returning to the in-person outreach, planting season, family gatherings, and local festivals. For example, one of my favorite things is the planting season, seeing how the fields start to get green and all of the growing starts. So I'm going to ask Angie to please put all of us in small breakout rooms so that we can have this conversation. So remember to share your name, your role in your organization, and what you are looking forward to in the spring. And then Angie, can we go one slide back? Okay, great. Now we have everybody back on. So how was that? Did you guys meet anybody new? I know that some of you guys, I was looking at the break rooms and some of us got in the same rooms with some of the same people that we know, but hopefully we got some variation this time with a little bit larger groups. Would anybody like to share their own experience? What are you looking forward to in the spring? I'm gonna pick on somebody too.
All right,
Hey,
you can
Esme.
pick on me, Esme. Don McMorrin, Director of WCU Skagit County Extension and the PI of the WRASAP grant, and I am looking forward to flying my airplane more this summer and spring.
That is really nice. So for me, I always really look forward to planting seeds and seeing which ones actually do come out, because it's wonderful to see a full grown tomato in the summer. Let's see who else. Let's
Hey,
ask.
Esme, I'll jump in because I wanted to kind of say something in my group. There was only a couple of people that I knew at all in the group, but and a couple of people that you and I met in Portland. But was really interesting to me is that a couple of people talked about fun things they're going to do, and a couple of people talked about their work and enjoying what they were doing at work during the summer, and so or during the spring. And I thought that was really cool, and just reminding everybody that that's fun, but it's also important that we as a group learn to enjoy things on our own and outside of work, so that we as a group can also manage our own stress.
Yeah, that's a really great point, Julie. I would like to pick on Annie since she is our presenter, and I'm interested on what she's looking forward to in the spring, so we can segue into her presentation.
Well, I think somebody raised their hand, so I think
we'll do Elena. Elena, do you want to go, and then we'll have Annie go?
Okay, quick. I was part of Julie's group, and I talk about work. Now I love the part about fun, and it's I love to play bocce, ping pong, and rock climbing. That's something nice. Thank you for reminding me about fun.
Elena, I don't know what bocce is. Can you enlighten me?
Sure, it's an Italian game. It's kind of similar to bowling, but it's heavier, smaller, kind of balls, and the goal is to hit in a small one, which is called palino. So it's 2 balls against 2 other balls, 2 teams of 2, and it is a very nice game to play any age, anytime. Cool. Find out about that. It's pretty fun.
Yeah, learning something new every day with you guys.
Sure.
All right, let me just check to make sure that nobody else has raised their hand, and then we can go into, okay, we can have Annie share.
hi. Okay, well, I'm a little negative. I'm just happy that the semester is going to be over soon. It's been teaching in COVID has been challenging, to say the least. So that, but I'm also excited in that my children, I live in San Diego, so it's kind of great weather all the time. So we have a year-round garden. But they just got caterpillars. And so we are going to be watching the little baby caterpillars grow into butterflies. So we are very excited about that happening.
That's really awesome. Let us know how the caterpillar project comes out.
I will.
Looking forward to it. All right, so with that, we'll segue into Annie's presentations. So now I will introduce her, and then we are going to have her present, and we're going to collect questions in the chat as we go, and then present them to her at the end. So Dr. Annie Keeney is a graduate of Colorado State University. She's an assistant professor in the School of Social Work at San Diego State University, and she serves as an evaluator for the NIOSH-funded High Plains Intermountain Center for Agricultural Health and Safety. Her areas of interest include social and service delivery policy for children, youth, and families living in rural communities, and depression, stress, and suicide risk factors for those working in agricultural production. She is presently researching how community-based organizations are serving the health and mental needs of farm workers and their families in Colorado, Utah, and California. So with that, we'll have her share her slides and take it away.
Can you, let's see, can you see my screen?
Yes.
Okay, all right, great. Well, thank you very, very much. I need to make sure I can, okay. I'm used to having two screens and I just have one screen today, so I'm kind of navigating things differently, but thank you so much, Esme, and thank you all for joining this afternoon. Like she shared, my name is Annie Keeney, and I will be chatting today about a recent study focused on examining occupational and COVID-19 stressors in farm workers in a US-Mexico border region. Before I get into today's agenda, I'd like to take a minute to acknowledge the Western Center for Agricultural Health and Safety, who funded this rapid response study, and then also for the Imperial Valley Equity and Justice Coalition for their partnership in this community kind of based research and their recruitment of the farm workers in Imperial. So topics we will tackle today, and I will try to go fast because I know we don't have tons of time. Some COVID-19 disparities, a deep dive into Imperial County, the purpose of our study, methods, findings, recommendations. I'll just quickly introduce the team members and then any questions and answers that you may have. So cultivators of the earth are the most valuable citizens. I wanted to set the stage for today's web talk with this quote from Thomas Jefferson back in 1785. And though these words were said more than like 225 years ago, the same holds true now, right, in 2022. So farm workers are the foundation of the agricultural sector in the United States, providing the labor that feeds the US and beyond. However, both historically and now during COVID-19 pandemic, these essential workers continue to have the worst health and safety outcomes than other occupations in the US. And we see farm workers are often at an increased risk of contracting and dying from COVID-19, even when other social determinants of health are controlled, such as poverty, insurance, and the COVID-19 language accessibility. So the COVID-19 pandemic exacerbated the social inequities that exist between different groups of workers. Essential non-health occupations, specifically workers in industries such as manufacturing, transportation, construction, food, and agriculture, are considered vital for maintaining the health and safety of the nation, though they weren't in the healthcare essential worker category. They're in the non-health essential worker. However, the occupational risk for COVID-19 exposure, infection, and poor mental health outcomes have been found greater among those low wage and precarious workers in those non-health essential occupations. In California, Chin and colleagues found sectors with the highest relative and per capita excess mortality were among transportation, facilities workers, and food and agriculture workers. And then across racial and ethnic groups, Chin and colleagues found Hispanic and Latino working age Californians experienced the highest relative excess mortality with 97 deaths per 100,000. And those were in the food and agricultural industry. So a little deep dive into Imperial County, California. It has the highest proportion of non-white residents in California. About 83% of the residents in Imperial are of Hispanic or Latino, and Imperial ranks the worst. So it ranks last, 58. It's 58 out of 58 California counties for social and economic factors such as injury, deaths, income inequality, unemployment, and children living in poverty. It also has the highest food insecurity rate in the state and the worst food environment index ranking per the USDA in the state as well. The COVID-19 mortality rate in Imperial was more than double the second highest county in California. And early research found that high worker distress and the large household sizes contributed to the infection and spread of COVID-19 in the region. And ag is huge in Imperial County. So it is the dominant sector within the region, 5 times more likely than other counties statewide or nationwide to work in agricultural in agricultural sector, and that equates to about 1 in 6 jobs are directly related to the agricultural sector in the county. The agricultural alone in Imperial generated more than about $4.4 billion to the local economy in 2021. It's often referred to as America's winter salad bowl because it produces more than 100 commodities, including 2/3 of the vegetables eaten during the winter in the US. So kind of to put in perspective the scale of Imperial's agricultural sales, just agricultural sales alone, it's about 10 times greater than the entire gross domestic product of the state of Vermont. Or another way of looking at it is that about approximately $12 million a day is generated from agriculture alone in the county. It is very geographically unique as it's located on the US-Mexico border, and farmers and ranchers in Imperial County depend on farm workers that can reside on both sides of the border to maintain operations. The group commuting from Mexicali, Baja California, Mexico, is considered the daytime farm worker population, and it's typically in the United States daily from about 2 or 3 in the morning, and then could come again around 4 to 6 to ensure that the food chain continues. Yet these workers remain essentially invisible to county public health efforts and are excluded from vital safety net programs. Hispanic and Latino and migrant workers experience high degrees of occupational stress, and they are most of California's agricultural workforce and were some of the most impacted populations with the COVID-19 pandemic. However, relatively little is known about the occupational stressors experienced by farm workers who commute daily between the US and Mexico. So occupational stress is considered an imbalance between the demands at work and the capabilities to respond in the context of the workforce. And so the goal of this study is to determine the type and severity of stressors in daytime and resident farm workers and how COVID-19 vaccination status may have contributed to these stressors. So we collected data over 3 months from June 2021 to August 2021 from farm workers working in Imperial County. Most surveys were administered in Spanish by bicultural and bilingual research team members who recorded responses in real time using Qualtrics, a web-based platform. And we offered a $10 gift card for participants' time spent answering the questions. The migrant farm worker stress inventory was used. It's an instrument used to measure the stress in migrant farm workers, and it has been found to be a reliable tool. And respondents rate each item on a 5-point scale of having not experienced to extremely stressful. And using the same 5-point scale, we also sought responses to 2 additional questions. We included an air quality question and also about sleep, if the farm workers were feeling as they were getting enough sleep. We uploaded data into SPSS 27 for analysis. And because we wanted to really describe the similarities and the differences between these 2 groups, we used descriptive analysis to kind of describe the sample overall, and then some different bivariate analysis used to examine some correlations. And then we also did a principal access factor analysis to assess the underlying structures of the items on the survey, to kind of see which items may be grouped together so we could get some latent factors out of there. So a total of 199 Hispanic Latino farm workers working in Imperial County participated in our study. Most residents indicated that they're nighttime residents on work days in the US, yet most respondents were foreign born. The overall age of respondents was 46 years old. Most respondents identified as male, about 40% identified as female. Women farm workers were more likely to be US nighttime residents, about 78% of the women versus about 59% of the males. The average commute time for respondents, so the time from leaving their residence to their work, to arriving to their work site, for the overall sample was just under 2 hours. And participants whose nighttime residence in Mexico had an average commute time of about 194 minutes compared to 72 minutes for the US nighttime residents. Slightly more than a quarter of respondents shared that they had tested positive for COVID-19 within the last year, and 75% of our respondents reported being fully vaccinated from COVID-19. So our principal factor analysis differentiated latent factors in our survey item, and it reduced to 5 stressor domains, essentially. The first factor was health and well-being vulnerabilities, and it contained 6 items reflecting the interpersonal and physical conditions that US-Mexico border farm workers are experiencing. The second factor was inadequate standards of living, unknown conditions of living, and it included 9 items reflecting feelings of social vulnerability and how unknown conditions of living resulting from farm work could impede obtaining an adequate standard of living. Working conditions had about, I think, had 5 items that were looking at the social, emotional, and physical protection related to the occupation of farm laborers. The working environment factor included 4 items reflecting concerns that respondents have on the field site, particularly among other farm workers. And then our 5th factor, language barriers, consisted of 2 items that were looking at how communicating in English can affect an individual stressor and in their working conditions. So the total score of the migrant farm worker stress inventory is obtained by summing the scores together for all the items. And higher scores mean a greater degree of stress related to the migrant farm worker lifestyle. Individual scores of 80 or more indicate that the individual may have stress levels that pose significant mental health risks. So 40% of our sample had a score of 80 or more, which indicates stress levels that pose significant clinical mental health concerns. And we also found that those farm workers with higher stress scores were more likely to be born in Mexico. So about 42% versus 22%. Out of all the assessed stressors, these were the top 10 stressors between both commuting and residential farm workers in Imperial. So sleep was the #1 stressor, being away from family members, bad weather, no medical care, working long hours, communicating in English, people using drugs, children's education, high air quality, and bathroom conditions were the top 10 stressors. So despite very similar social and cultural characteristics, the results that we found so far show that age and country of birth, so foreign-born variables, can predict greater levels of stress associated with the lifestyle, the farm worker lifestyle, than nighttime residents, where our group kind of thought that nighttime residents might play a factor into this. This finding supports research on enduring the impact of experiences of citizenship, language, cultural barriers, as foreign-born workers residing in Mexico and the US were both more likely to experience elevated levels of stress. Of note, the top stressors did vary. The number one stressor did vary between the groups when we looked at them separately, with Mexican nighttime residents more likely to experience stress associated with lack of sleep, and US residents expressed more stress with weather and air quality. So COVID-19, a positive COVID-19 test result and vaccination status were not significantly correlated with nighttime residents. The lack of statistical significance or difference in these COVID infections is particularly noteworthy, since there was much concern in the region that the daily migrants would be more exposed to COVID-19 due to clustering at the international crossing, waiting for buses together, and then busing together at the work sites. So there was an assumption in the region that US resident workers would have a lower risk of infection from safer commutes. But these findings kind of show that maybe COVID-19 infections were more likely to happen at the actual work site, perhaps due to prolonged close contact and lack of protective equipment, both which have been found in previous studies as well. Receiving the COVID-19 vaccine and difficulty in communicating in English were significantly correlated together. The direction of this correlation was positive, meaning that participants who received the COVID-19 vaccine tended to report more stress related to communicating in the English language. And so we really credit our community partners and the community outreach in Spanish as positively impacting the vaccination rates among the region's farm workers. So the kind of shifting to the discussion of like kind of where do we go with all of this? The top 5 stressors experienced by respondents were related to sleep, family, working conditions, and the working environment. So conditions are typically associated with how a person physically or mentally feels, whereas environment can mean the immediate physical surroundings of that person, right? Including nature, people, climate. And these nuances were really most pronounced in the unfavorable working conditions and the working environment factors that were derived from our principal factor analysis. So that analysis put different items, different stressors together, like clustered them, right? And so of interest was from our findings was that other substance use or others drug use stressors hung together with respondents' concerns of air quality and bathroom conditions. So kind of suggesting that substance abuse was a visible part of the physical work environment. And so given our study's context of daily migration and the legalized recreational marijuana in California, there's an increased concern not only for US-Mexico border farm worker substance use, but for the secondhand effects of substance use that can contribute to an overall feeling of being in an unsafe and unhealthy work environment. So safe and healthy work conditions are essential for decent work. And so our study really increases our understanding of how fundamental worker and human rights are needed to support precarious workers' overall health and safety in the ag sector. Prior to COVID-19 in 2019, this is what our International Labor Organization said, that safe and healthy working conditions are essential for work. So occupational justice is particularly significant today, and ensuring the health and safety at work, specifically among low-wage, non-health essential occupations, is really imperative to pandemic management, public health prevention efforts, and protecting a very highly vulnerable workforce. Mental health in the region remains a low priority. As indicated, there is about one mental health provider per 660 residents in Imperial County, which is about 2.4 times higher than the state ratio. And so we really encourage farm and ranch employers to take steps to support behavioral health resources and treatments proactively. By doing so, we kind of think that employers in the US-Mexico border region may see a reduction of the secondhand effects of substance abuse, thus further creating a safer, healthier, and more productive work environment that has the potential to increase profit significantly. So, for example, within the agricultural industry, it is estimated that per capita costs to employers for each untreated worker with a substance use disorder was $2,689. And so given the scale of the region's agricultural operations and the required workforce needed to maintain those operations, cost savings could probably be in the billions. In 2000, there was a study for Texas farm workers and the estimated cost of lost productivity due to alcohol and drug use was $11.2 billion. So, excuse me, I've been talking a lot. Our findings have several practice and policy implications. Some stressors could be easily improved upon, and it is critical that local farming associations advocate for efforts to reduce the stressors within their control. So, for example, advocating for improving or increasing bathroom conditions and the capacities in the field could really improve the health and safety and reduce some stress levels. So either adding more bathrooms there or getting them cleaned more frequently could maybe alleviate some of those stressors. Bathroom conditions were in the top third of stressors for all respondents. And we really feel that could have immediate positive implications to this vulnerable workforce. We also recommend investing in more Spanish language access to routine public health information and targeted behavioral health campaigns to help essential workers navigate these stressors. Occupational justice and work-life well-being must be considered as one of these determinants. So the World Health Organization shared that to deal with the burden of mental illness and to reduce some of those outcomes and vulnerabilities, attention needs to urgently be paid to the determinants that can be modified on the development, onset, progression, and outcome of mental problems. And we really feel that occupational health and safety needs need to be considered as one of these determinants, and how we recognize cultural differences, judgments, and theories related to mental health among Hispanic and Latino farm workers should further explore these ideas. So this is a QR code. You can take a picture of this QR code and it will take you to the full article or study that my team and I did. It's published in an open access journal, so you should be able to download the PDF right away. It's in the International Journal of Environmental Research and Public Health. And then this was our research team. So you are aware of me, but we had Dr. Amy Quant. She was the co-investigator. She's within the Department of Geography at San Diego State University. And then we had Daniela Flores and Luis Flores, who are co-founders of the Imperial Valley Equity and Justice Coalition, who we could not have done this study without their wonderful efforts and community outreach for these farm worker populations on the border. So that's a lot. Any questions that I can answer, hopefully?
See, I haven't seen any questions yet, but I did want to just kind of offer some comments that it's very interesting to see how a lot of the same stressors that affect farm workers are the same ones that tend to affect the farm workers. So like the sleep, weather, you cannot really control the weather around what's being planted, what's being farmed. So it's, again, it always just kind of reminds me of that we need to be working more together when we're talking about farm worker health. And that's one of the things that I really value about the Western Regional Agricultural Stress Assistance Program, that we're trying to build these bridges and work on the health of both the farmer and the farm worker, because it's all tied back to the farm and feeding the country and the world. We do have a question. I see that Clinton has his hand up, his virtual hand up.
Yeah, my virtual hand. I was just wondering if you could talk a little bit more about how the workers get back and forth across the border each day, and about the difference between men and women sleeping here or sleeping in the US or sleeping in Mexico, and how that kind of works. I found those statistics to be intriguing and wild.
Yeah. Oh,
I can imagine.
okay. So I don't exactly know if you're on the Mexico border side living in Baja, California. I'm not sure where some can maybe live in, housing, or, like farm worker housing. Most didn't. Most, I think, were residential, and they just would commute to, however they could get there, they would commute to the international border, right? And so then once they crossed over the border, oftentimes there's transportation sites. So there's buses, there's companies that contract with the farms in the region that will say, we will bring this team, right? We bring these team of workers to you. And so then that's how they get to the field site, typically from those efforts there. Now with the difference between men and women. So yes, so we looked at, the nighttime residents, like where were you sleeping on work days, essentially, because we tried to really figure out a way to measure this, because it's such a fluid border. Like, it's very, very fluid. A lot of people get healthcare on both sides. If they can't get it quick enough in the US, they cross the border and go to Mexicali. And so we were trying to figure out what that looked like. And so out of, we did have more, 60% of our respondents were male, right? Versus about 40. But most of the farm workers that claimed, a US nighttime residence were women. So that kind of just speaks to more, I think, the demographic makeup of Imperial County. So there's a high, Imperial has a very high family, single family, female headed household. So I think that kind of speaks to some of those demographics, essentially. And then males more likely to make that big commute from the border were, I think, there. Does that help answer?
Yeah, thanks a lot. Yeah, no, that just, that was eye-opening. Thanks for sharing that.
So we also have a question from Rick. If you'd like to unmute, Rick.
Thank you, Esmeralda. Hi, Annie. Thank you for your wonderful presentation and research you've done. It's pretty in-depth. I'm a clinical social worker, and I really focus on mental health, substance abuse issues, which are very separate, although correlated. In your study, you mentioned some of the factors of economic cost impact of substance use. Oftentimes, as there are mental health professionals on here will know that the underlying issues of often substance abuse or alcohol is, trauma related. And I would like to see more of that, or there's more research going into, from your study, the types of, whether it's immigration trauma or trauma from a local community or political climate that are being affected, or is it just household trauma that is happening? And because we can treat folks with substance abuse, alcoholism, but if we don't address the trauma, then it keeps coming back, or the substance use doesn't go away.
Yeah, well, yes, I wholeheartedly agree with you on all of those different aspects of trauma that can impact an individual's, substance abuse behaviors. I also, with the caveat that it's very, you have to keep in mind this population. So a lot of where your substance abuse might be is to be able to get through the work, right? To be able to have enough energy in the field to work through it. Or I know, like in our qualitative interviews, somebody shared, that they had a problem with that, with, opioids, and it was because his knees hurt so much from the work, he just kept taking the pain pill, the pain pills, and kept doing that, and that kind of developed that way too. So, and then with our study, what we found was it was the secondhand effects of it. So I absolutely agree. So like, what does that mean? So if somebody is if a coworker is triggered, right, or is stressed by witnessing another person engaging in these kind of behaviors, like, let's unpack that a little bit. Is that because it's a trauma response, or is there something there, or are they demonstrating unsafe behavior, on the working environment, and that reflects to them, right? So a lot of things, but yes, I wholeheartedly agree, having that trauma lens as well for the substance abuse behavioral health.
Yeah. Thank you.
Thank you for your question, Rick. Annie, another comment that we have on the chat is from Randall. Any thoughts or ideas on how to reduce commute time for farm workers?
That's a great question. I do not know. We didn't talk about that as my team. I can certainly, I feel like that's kind of part of the lay of the land there, especially if you're including the international border crossing. So what's hard with that, which we found that came out about our qualitative interviews too, is it was very unpredictable. So COVID made it very unpredictable. Like, how long was it going to take to cross the border? How, would I be able to get to work or not? So now that we're a little bit past that, I think there's crossing times that are a little bit more predictable, but those are aspects that are a significant chunk of that individual's commute time that I'm not sure how we could manage effectively.
Thank you, Annie. Here, another question is, was access to potable water not identified as a concern? I can say in rural frontier Southeast Colorado, it is a major topic.
Yeah, what's interesting is we assess that having access to clean water, or something, in so many words on the item with one of our items on the survey, and it was not in the top. It was more in the bathroom, right? The bathroom conditions, sleep, observing other people's substance use. So yeah, I think that I don't know, that speaks to the uniqueness of, Colorado Ag versus Imperial County,
Yeah, I just kind of thinking of that. And I wonder if, because we are in California, like laws and regulations of providing water might have something to do with it. Since in California, we did have that big campaign of water, rest, shade, which I mean, tragically also arose because of a death of a farm worker in extreme heat, and she was a pregnant farm worker. So that allowed for, sadly, that is what triggered some of these laws, which provide, or are supposed to provide, more clean water to the farm workers. So there might also be a factor of which state and regulations there are.
Yeah, thank you.
Well, Annie, I don't see any more questions. I did put a link in the chat for your articles, and people were asking about the QR code. I think it went a little bit fast, but there is a link on the chat. No, it's okay. There is the link in the chat if you would like the article. Okay. So with that, we're going to move into some of our shorter announcements. This is just a gentle reminder, this is an 1.5-hour networking event. And then the next thing that we're going to do is we're going to have Lori speak about, Michelle Grogi wasn't able to join us today, but she's going to tell us a little bit about what WRASAP is doing in terms of baseline data. So similar to what Annie has been doing in Imperial County, the goal of WRASAP is to really look at this larger broad area of 13 states and 4 territories and gather data from those areas to inform programming that is funded through USDA and also through the FARSAN grant. So Lori, I do have a slide that we can share.
Esme, I have slides.
Okay, awesome.
So I'll do that. Hi, everyone. I am Lori Meyer, and I am Michelle Groki's admin assistant. And Michelle wanted me to let everyone know that she regrets not being able to be here. Her little boy is sick and her husband's not at home. So she asked me to step in. I helped her make the slides the last couple days. So I'm going to give it a whirl here. I'm going to share my screen. Let's see. Oh, wait, this one right here. Okay, do you see that, everyone? So basically, like Esme said, the agricultural workers survey that the baseline team from WRASAP has developed is now up and open. And this survey seeks to understand the stressors that agriculture workers in our region, that's the 13 states and 4 territories, what they're facing. They're also going to be asked about stress management topics that they feel they'd be interested in learning about. And so the plan is that the different states and territories can then take this information and utilize that and tailor their outreach activities towards that. We're going to ask that all of you please help disseminate this survey to egg workers in your community. You can do this by writing an email to partners and embed the direct survey link. We'll provide that link to you. You can post to social media accounts using a Facebook post we've already created. You also can create your own Facebook post. We just gave an idea and tried to make it easy for everyone. Also, if egg workers in your community would benefit from having paper copies, you can get in touch with me, and that's my email address. I can send you out as many paper copies as you need. I also, we have them both available in English and Spanish. If you need me to print them and mail them to you, I absolutely can. If you need me to just provide you PDFs of those copies so you can print them yourself, I certainly can. Just let me know what you need. I'm happy to help. The survey is going to remain open through 2022, through the year. However, we don't want to stress that to people. We want to make sure that we want data coming in as soon as possible. So we're not publishing that date on like the Facebook ad and things like that, because if you say something, hey, you've got an entire year to fill out this survey, we don't want people to put it on the back burner. We'd like them to get it taken care of now. And then at the end of the survey, participants are asked whether they're interested in participating in a phone interview. And this is the same situation as our egg producer survey, where we randomly choose 6 participants of the written survey for $50 gift cards. And then if someone chooses to participate in the in-person interview, they'll also get, or they will get a $75 Visa gift card. We're not advertising that as much, just to keep down the possibility of having some spam coming through, although we do have the survey pretty well set for that. So the next thing that, oh, hold on here. So Michelle just wanted me to give a couple examples of some of the questions. They're similar topic areas such as this perceived stress scale, stressors, and topics of interest. However, they have been changed somewhat, some of the questions for the egg workers. The perceived stress scale here, that's included Obviously, this has not been changed. This is standard. The stressors, you can see some of the questions: lack of access to reliable transportation, discrimination or racist treatment in the community, difficulty getting to the United States to work. Similar ideas like that, but very different questions than what we asked in the egg producer survey. Topics, these would be, how interested would you be learning about these topics if the content was available to you? So we have drug and alcohol misuse, sensation, vocational support, mindfulness. A lot of these are very similar to what we did have in the egg producer survey. And then lastly, again, we touch on dissemination strategies. What's going to be most helpful to get the information out to these egg workers? This includes everything from social media to telephone helplines to in-person things, religious, spiritual leaders, things like that. And then we also ask a few demographic questions on the survey. Some additional questions that we ask on this that were not asked on the egg producer survey are like, what best describes their work on the farm or ranch? Are they working full-time? Are they working part-time? And then how many months of the year are they working? So we really want to know how many people are seasonal, full-time, whether they're they consider themselves migrant workers and whatnot. And then this is the link where the survey is live, and this is on the WRASAP website at farmstress.us. And you can, maybe if someone's on the chat, they can pop in the actual link to this for me. And then this is, you can see here, you can take it in both English and in Spanish. And then you're welcome to share it with people. That would be great. And I believe, and then this is our example Facebook ad that we have. And like for Montana, we're going to put the MSU extension logo on the ad. And we're going to, rather than say, we're going to tailor the text to say, are you an agriculture worker in Montana? And the survey does take on average 12 minutes. So we really want people to know that it's not a huge deal to fill out. And then there's a link here for all of you. If you are interested in getting this ad, you can click on this link and it will take you to a downloadable version of that. And that's in the member portal. And that is all I had. And I will grab that link right now and put it in the chat for everyone. Does anyone have any questions on that?
Shannon already put the link in.
Thank you, Shannon. You rock.
Yeah, thank you, Laurie. Please give Michelle our best. We hope her baby is feeling better quickly, and we hope to see her pretty soon. We'll see her pretty soon. So Shannon did put in the chat the link to the survey. If you can also put the direct link to the member portal, I think that would be a good idea. I think we have some new people in the meeting today that may not be familiar with the member portal. The member portal essentially is a portal for which you'll need like a password and access some of the WRASAP materials that are being produced. For example, the results of these surveys are stored in there and you're able to access them that way. And thank you, Shannon. She has put in the chat the member portal login. Now we're going to go with some announcements. And this will be some announcements from we're going to have Julie, our WRASAP program coordinator, speak to us about upcoming trainings.
Hi, all. I'm just kind of giving you a basic understanding of the mental health first aid trainings and the QPR trainings. You can register for QPR trainings in English and in Spanish on the WRASAP website. They are still being offered virtually, and the those are free, the QPR trainings. And so those will go for a few more months yet. And then I wanted to kind of specify who we're looking for to participate in the trainings. The QPR trainings are especially great for people who are people who have incidental contact with farmers and farm workers. So the grocery store clerk, an extension worker, who happens to be in the office, just anybody who has incidental, like occasional contact, and the general public, like farmers' families. And the idea is that if we can get QPR training out to as many people as possible surrounding farmers and ag workers, that by that saturation, a number of people will be able to observe potential stressors or potential stress reactions, and will have the tools to be able to manage that. However, for the people who are more professionally related and would see a farmer or an agriculture worker in a professional context, such as an extension director, a local pastor, the head of an organization that works with farmers or ag workers, that would be better served by the mental health first aid training. And at this point, we are offering those virtually. Either connect with either myself or Allison Brennan if you would like to schedule one of those trainings, and that can be scheduled free of charge for you as well. At some point, we would like to offer the mental health first aid trainings in person, but that would take a little bit more trying to get schedules organized. So at this point, we can schedule something virtually, but connect with either myself or Allison Brennan if you are interested in that particular training. And that's all I have.
Thank you, Julie.
Thanks, Esme.
You can just pop in your email in the chat so that if anybody
I will
would
do
like
so.
to reach out to you, you can do that. So now I would like to open the floor for any network comments. If anybody has a comment or has a question or would like to just say anything, I do want to remind everybody that in these meetings, we are trying to kind of get to know each other as much as possible, but also get to know some of the work that we're doing within WRASAP. And so I'll just check to see if anybody has their hand up, wants to say anything. Usually don't have a lot of volunteers for this portion, but it's okay. We always want to make sure that we give the opportunity for the floor to be open. Great. All right. So we'll move on to our next portion. So some of the closing statements that I wanted to share with you guys is that WRASAP does have a small grants funding program. So in this program, what we are trying to do is to invite our partners, collaborators, and individuals or organizations that are joining this meeting to apply for funding through the small grants program. And the goal of this funding program is to support strategies which address agricultural stress in the Western region. Again, those 13 states and 4 territories. The small grants are offered 4 times a year in the fall, winter, spring, and summer. We did just close our previous cycle, which closed on March 31st. We will be reviewing the applications for those. And then these grants are up to $10,000 to educate yourself, your organization, or reduce agricultural related stress and or prevent agricultural suicides in your state or territory. Funding opportunities are available in 3 categories. So that can be translation, outreach, and professional development. And when we say outreach, when we talk about translation, we don't necessarily just mean translating one document from one language to the next. It can also be content that is perhaps not directly speaking to the culture of farmers or farm workers. It can be adapting so that the content can reach the farmers or the farm workers to help them. So you can be pretty creative with this funding. What we're trying to do is support initiatives that will help address farm worker stress, because we understand that that can be done in multiple ways, and we want to support these projects. We also want to invite you to join the network. So every quarter we have these meetings to kind of get to know each other, present some of the work that's being done in the WRASAP network, and just kind of support each other, get ideas, grow with each other. So do share this with us. You can also go onto our webpage, which is farmstress.us, and you can sign up for our newsletters. Those also come out quarterly, and just a reminder that WRASAP is open to everyone. It doesn't necessarily have to be a working professional. It can be a community member, a farm worker. We understand that this is a big effort, and we want to make it as rich as possible with different views, points of views from different aspects and different people that can help support this this big mission. I did see that somebody raised their hand. I didn't see the name, so if you would like to unmute, please go
Looks
ahead.
like Elvira.
Elvira. Okay, Elvira. Okay, thank you, Elvira.
Thank you. Yeah, I really am interested in the small grant funding opportunity. So I am going to reach out. Would I reach out to you or Shannon or Julie?
So first you can check out the farmstress.us small grants program.
Okay.
And then Julie, who I think it might be you.
Yeah,
will
go
be
ahead
Julie.
and go ahead
Okay,
and look
great.
at the webpage. Shannon put it in there, the small grants. There's a direct link there. Read about it. Go ahead and look at the application, and then the application, which is now fully online. And then if you have any additional questions, reach out to me.
Okay, great. And then also on another part, I think I just wanted to go back to Annie sharing like announcements and stuff. I just wanted to thank Esme, Shannon, and Lori for helping me out putting together promotional items. We are, the University of Guam is going to be doing their Farmer Focus Wellness Conference in June 17. And I just want to really thank them for helping me out, getting those items over. I saw the email, Shannon, thank you very much. We're really excited to see all the final products. But yeah, we're really excited. Yesterday we had our 2 days ago, we had our first outreach advertising our conference. And so we had a lot of support and interest from our local community, as well as the farmers and farm workers who were there. So yeah, we're just going to continue doing more outreach. We have another outreach next month, which is for farmer appreciation. And so, yeah, we were just really looking forward to having our regional and national partners come out. So thank you, Dr. Dawn, Dr. Verma's team. Can't wait to see you, Julie, and as well as Dr. Michelle. So I really hope her son is okay. So yes, please send out our regards to her and her family. And yeah, thank you. That was all.
Thank you so much, Elvira. Thank you so much for sharing and for it looks like you're already pretty connected with WRASAP, so thank you for doing that. And again, just a reminder that this is a network. We really want to be able to support each other in the work that we're doing to reach farmers and farm workers. I do want to just mention that our next meeting will be in July. So these are quarterly meetings. We still do not have a date, but if everybody that has registered will receive the information for the next meeting. And lastly, I'd like to thank you guys for attending WRASAP, everybody that's working on this project, the California Agribility, of course, and USDA NIFA, the Farm and Ranch Stress Assistance Network, as they are the larger program that is supporting the network development. Thank you, everybody, and really hope to see everybody in the next one in July. We'll see everybody in July.
Thank you, Esme.
Thank you.